to another episode of the Gaslit Truth Podcast. I am your host, Dr. Teralyn, with our other host, Therapist
Therapist
Jenn.
Jenn. Whoop, whoop. Hello.
And we are going to be tackling some pretty tough things. As
Yes.
I was doing the research on this one, I literally felt a little bit sick to my stomach thinking it through. And so we're just going to have some dialogue over this. And we are going to be talking a little bit about weird science.
I can't wait. Not that I enjoy this, but I might.
Okay, so if our listeners are listening and they are of our genre, you might
Sure.
remember that movie Weird Science from I don't know,
Mhm.
the late 80s, I believe.
Yeah, I don't even know what
It was a
what year it
horrible
was.
movie, by the way.
It wasn't a great movie. No, and not at all. But boy, the message and how it translates to today for us, right? And this idea of that you can create something that's so fantastic and beautiful and perfect and fool everybody.
Oh
Uh,
yeah.
oh, hello. That's exactly. Talk about being gaslit into believing something, right? These two characters in this movie, that's all they did, right? They created a woman out of a bedroom, out of a computer, right? And and she was everything. She was the whole world. They fooled everybody with this
Yep.
girlfriend, this woman that they had everywhere, right? And she was truth, and everyone took it at face value.
Yes. So
Yeah.
that's the catchphrase of she blinded me with science. And
She
so
blinded
she
me.
blinded me with science.
Oh my God,
Now,
what a bad song. That's so good though. I just love to
so
hate it, right?
I know, right? So here's our moment of truth, Jen. Get your
Yeah,
prop ready.
I'm ready.
So if you want to see what we're doing, head over to
Yeah,
Instagram and you can
yeah,
actually
yeah.
see the video. But
Yes.
this is the
Shh.
iconic.
Yes,
This is
here we
the
go.
iconic.
Here we go. Here we go.
Yeah.
Yes, gotta
It
put this
doesn't look
bra. Look at
exactly
this.
right, but
Okay, so
they,
here we do. We're gonna sit here, ready, with our bras on our heads, and we're gonna create. We're gonna create a
oh,
woman. Okay, maybe not a woman. We're gonna create some fantastic like scheme that everyone's gonna believe, and it's gonna be
mm,
shiny and pretty, and that people are gonna think that we are totally associated with it. We live by it, die by it, breathe by it, and whatever we create, that's the only truth.
the
That's it.
only
There's
truth.
no other way to view her. She's a gorgeous woman. She's got all the things.
Hmm.
We made her. We made her with our bras.
We made it with our
Here we
bras
go.
on our
Oh
head.
my God. Okay. I feel good. I feel good wearing
I
this
gotta
right now.
think.
Have you ever put a bra on your bed or on your head in public for something before?
No, I rarely wear a bra on my boobs
Oh.
in public
Oh
anymore.
shoot. Okay. Dang it. Oh, that's a great
I had to dig this
self-disclosure.
one deep. I had to
Did
dig
you?
this one deep out of the drawer for this
Oh, yeah.
presentation, and it
Mine
looks way bigger than what I actually need, just in case anyone was
Isn't it
wondering.
isn't it kind of funny too, like how we I'm gonna just go off for a bit, then you could pull me back, but here I am with this bra, right? And like even this bra is a lie because first of all,
Oh,
this is all padding. Like this is all
truth.
padding,
Look at
right?
how structured this thing is. Like,
It's perfect.
guys, if you're watching this, look at
Yeah,
how much padding is on this
yeah. I
just
mean,
to keep
this
a shape.
like look at this perfect. Look at that.
Crazy.
Perfect.
Craziness.
This
Circus.
is a lie. This whole thing
This
is a
one is a
lie.
lie too. This is a
Okay,
huge
right?
lie.
This is a lie.
Huge lie.
But yeah, but go home if you're, if you're seeing this, go find a bra, put it on your head. It's kind of liberating, actually,
Yeah,
and
it
then
might
talk
be.
about how big of a lie it is for yourself because they usually are, right? We don't usually we don't wear them. The purpose is to give a little boost, to
Mhm.
make things look the same symmetrical size,
Both
right?
sides.
Which
Mhm.
man, is that
The
not real?
agreeable size, and so it's interesting when you think about it because they were sitting around with these bras on their head
Yeah.
concocting the most beautiful woman or the beautiful experience, and it
Yes,
was all a
it was
big
all a lie. It
fat lie.
was all a
And
lie.
so
Yeah. Ooh,
now we're
wow.
gonna segue into what we're really talking about today, which is, even harder to talk about,
Science lies sometimes, and what
in
we see
marketing.
in front of us in marketing lies.
Yes, so
Oh, it
we're
does
gonna be
suck.
talking about
Yeah.
big pharma marketing, and,
Yeah.
and I think the Super Bowl was a great opportunity, a recent opportunity to talk
Yes,
about this
it
because
is.
they had a big Super Bowl commercial, Pfizer did.
Yes.
And I did not watch it when the Super Bowl was happening. I watched the 3rd and 4th quarter of the Super Bowl. So I missed the ad, but I did watch it again on YouTube because it is
Yep.
on
Yeah.
YouTube.
Yeah.
And I she's blank. She
I
blinded me with
I
science.
am. I'm
Don't
like
do it. We're
pulling up.
gonna get copyright
Yeah.
problems if
Look
you
at this.
hear the
Look at
song.
this.
Yeah. Oh yeah. So
So
Jen did a video on the Super Bowl marketing
yeah.
campaign
Yeah.
and put it on her TikTok. So
I
find
did. I
Therapist
did.
Jenn over on
I
TikTok.
was so taken back by that commercial, and I did, I did see it. I was there with my family, right? And we're just sitting watching this, and I did not, and I'm assuming we're gonna pick through this a little bit, right? And talk
Mhm.
about it because I did not realize that it was a Big Pharma commercial right away.
Right.
Because I'm watching all this and I'm thinking, I wonder if this is an insurance company because it was so
Well,
um
insurance companies are the second largest advertisers, but you know.
right, right. It was super comforting. So all the way up
Mhm.
until the actual, like it even said the word science in it. And I was
Mhm.
like, what is this? And it felt so good. And then the Pfizer logo popped and I went,
Oh.
you just walked me through cancer patients. You walked me through all
Yeah.
this journey. And then of course I got sick and then sat there for a hot second and went, nope, I'm gonna channel this right now. And I'm on the couch and I'm taking a picture of myself and throwing this up on social media. And
Oh, that was
oh,
in real time
oh,
then
real
when you
time.
did
This happened right
okay.
during the Super Bowl. Only
All right.
294 people viewed it. Damn it.
Come on,
But
she
I
needs
know.
more love
Woo!
on that
But I
post
was
because
like,
it was
this
worth it.
it hits
Mhm.
home for so many reasons. So
Mhm.
that it felt so good to see that commercial until the end. I mean, and it pulled on your heartstrings because
It
what
did.
I mean, I'm assuming you went back here and watched this, right?
Mhm.
Like, what did you feel when you saw that? Do you remember watching that commercial?
Confused. I felt a little confused because I wasn't really sure where they were going. Now, after looking at it again, after I heard a lot of people talk about it, I think I didn't have fresh eyes, you know what I mean? Because it wasn't like
Sure.
a surprise
Sure.
anymore. So,
Yeah, I suppose. You
there were
knew going into it, right? Like,
yes.
it was a Big Pharma commercial?
And
Okay,
to be
yeah.
honest,
Yeah,
I gotta check my own bias here at the door because anything Big Pharma does, I get a little biased about
I do
anyhow.
too.
So,
I do too.
it's hard. So I'm trying to look at this from curiosity, but there was 2 places in the very end that says, "Here's to science." And I
Here's
was
just
like,
here's
"Alright."
the science.
Really? Like, that's
Oh,
just for me,
oh,
that's just too much because I know how horrible their science often is, and then I'm like, "Okay." But to be fair, there are some really good pharmaceutical interventions out there, so when Jen and I talk, we're mostly talking
yeah.
about psychiatric medication here, so,
Right.
um
That's more of our, I mean, we can be transparent with that, right? Like, that's
yeah.
more of our niche area, right? So
Right. So
when
we're
we're
never
helping,
saying
yes.
that
Yeah,
pharmaceutical
yeah.
all around is terrible. But
No.
you still have to get curious about a lot of things. But it said,
Yes.
here's to science. And then the next word it says, here's to the next fight. And I went, oh, they're calling Jen and I in for the play.
Here we
Like,
go. We're ready.
yeah, exactly. Like, we're ready, coach. Put
I'll
us in, you know?
bring my bra. I'm bringing my bra.
Exactly. But I was like, I
Right,
feel really
right?
called out right now. Here's to the next fight. And then it was the cancer stuff. And I was like,
It
oh,
was.
that makes me
It
feel terrible.
was.
But I was like, that
Um,
of course, they do so well with marketing, like, I used to be in marketing, right? It's like I used to make television commercials back in the day, and these guys are geniuses, like, if you go
yeah.
back to watch, especially the early well, actually all of them, but the early psych med, advertisements are like, "This is gonna be the best thing you've ever done in your entire life."
Right.
And yeah, but the whole while they're showing, shiny, happy people, and then they're
Mhm.
giving the list of these devastating side effects, which are extremely devastating. But when you put them against a shiny, happy person visually and
Right.
nice, cheerful music, you
Mhm.
can say whatever the hell you want. And people are like,
Mhm.
I want visually what this person has.
Yes.
You're not even paying attention to the
Yes.
side effects of, your life is gonna be relatively horrific probably if you take this
Yes.
stuff, you know?
That
Oh, by the way, you might die, you might all
correct.
these things, and
That
you're like,
that comfort, they hit you right where it
"They
feels
really
good, and
do."
so as a consumer, And somebody that was in that commercial for the first time seeing it, like I didn't go back and heard about it and knew, oh, there was a Pfizer commercial, right? I
Mhm.
was there in real time with it. And I remember sitting on the couch and it just felt everything was very comforting.
Mhm.
The whole commercial put me in a space of I wasn't anxious. I wasn't even curious. Like I was part of me was like, I wonder who it is, right? Because every commercial for the Super Bowl, you're kind of like, I wonder who's
Right, in the
advertising this,
end,
right?
like, "Who
And that's
is
part of
this?"
yeah, that's
Mhm.
part of the game, right? Which is
Right.
neat because that's the excitement of it all. But I felt so comfortable. And I sat there and it was just like, they show hardship. They show people that are climbing these metaphorical mountains, right? And pushing through such hard things, right? And it's like, yeah, here's to the people that have this ailment. Here's, they bring all the diversity into it, right? It's not just a bunch of white people sitting at a table, right? Like you've got economic diversity, you've got cultural diversity, you've got religious diversity. Like I don't know if you picked all of this out of that commercial. They hit every single one of those. And for me, I was
Well,
like, this is great.
well, they
This is
need
what
to
we
because they
need.
want all
Yes.
the consumers here, you know?
Yes. And I
They are
thought,
all
and
one
for me, I'm
consumer.
like, yes, and I am
Mhm.
very for me that's very comforting coming from a world that has very little diversity geographically for me, okay, like in my family systems, all the above, right?
Right.
And I am always vigilant with that because I enjoy that. So for me as a consumer, I pulled that in and I saw all the people, all the races, all the environments, the from the poverty line to someone that appeared a little more wealthy, the way they were presenting everything, all the above.
Mhm.
And it felt so good, and I'm like, "This is" and look how hard they're fighting.
Kumbaya.
Look how hard they're fighting. It's
It's kumbaya.
fantastic.
Yeah.
Everybody's yeah,
It's what
we're
we all need right now. We
heal the
need
world, make it
yes,
a better place.
yes.
Where the hell was Michael? The
We
spirit of
are the
Michael in all
world.
of this.
We are the
Yes,
children.
the children.
Yeah.
Like, I just it was so good. So I felt that. Whatever I'm describing is what I felt, and that's exactly what they want,
Yes.
right? Like,
Oh, I'm
that's what
sure
you
you're not
want.
the only one that felt that. As a
Yeah.
matter of fact, so I found this article that when I look, if you see me looking, I'm looking at another monitor. Pfizer won the pharma ad Super Bowl.
Yeah.
So it says that's the conclusion of TV Outcomes Company, EDO, which found Pfizer saw more incremental online activity for its brand than fellow Super Bowl advertiser Astellas after they ran their ads at the big game, which means they won.
They
They
won.
they won. And so I'm like, "Oh my god, stands to reason they track all this stuff, right? Like
Right.
stats are a thing.
Yeah.
So they tracked that this ad drove more people to Pfizer's website than other ads. And I'm like, wow, it says they beat the median by 88% in by the level of engagement. So I'm like,
Wow.
yeah, that's crazy.
Wow.
That's crazy. And so I think about this stuff and I did I have a bunch of numbers that I think we need to talk about too with this,
Okay.
but I found a study. This is so fascinating to me.
Are you
Um
gonna geek out? You're gonna geek
a
out here.
little bit, just a little bit. So
Okay.
there was a study published in JAMA in 2023. And this study looked at, I think it was a meta-analysis of a bunch of different studies, but they reported that Big Pharma spent more money advertising for drugs that have lower health benefits for patients. That 90% target consumers directly than clinicians, which drives patient demand for drugs that a clinician wouldn't likely prescribe. And I thought about this drugs that have lower health benefits for patients. They
Okay.
anyways, what I looked at didn't like I'm sure if I looked deeper, because this was literally a 5-minute review that I did, I'm sure they had different classifications. I would guess things like creams maybe don't have a
Sure.
high health
Sure.
benefit and stuff like that.
Yes.
But I
Yes.
thought about, psychiatric medications. I mean, they're spending tons and tons of dollars and marketing time and energy on psych meds, and do they really have high health benefits? I don't I don't think they
Yeah.
do. So I
Yeah.
think psych meds could probably go in the category of a lower health benefit drug. I
I think so too, right? And I also, from what we know from, and I'm not the, the biggest researcher, like I can't quote this stat right now, but we also know that the cost to generate antidepressants is lower than the cost to generate some of these other drugs.
Right.
And so you think about that as well. And so for them, if you get curious about this, it's kind of a win-win, because for me to generate this bottle of, Lexapro, and to put 30 pills in there,
Cheap.
right, is pennies on the dollar, right? And so there's these horrific, and I can say horrific because that's my truth going through this. There's a horrific cost to the side effects to this, nutritionally, metaphysically, all the above. Okay. Right. And so, but it was really cheap to generate that. And so that's it. We're going to take and put bigger advertising dollars into those medications, but they're so accessible. So
Yes,
let's
and
pump that
well,
out. And
and
it's cheap to make them.
yeah, people who are on state funding, insurance like Medicaid,
Yep.
and I believe it's Medicaid, are prescribed at the highest rates of any
Correct.
other person. So
Yes.
they're looking for cheap, easy, and
Mhm.
accessible, and also,
Mhm.
I don't know, preying on the backs of people who are relatively suffering in the state
Yes.
of desperation, things like that.
Yes.
But that's not always just a mental health thing, that's a socioeconomic thing. Like, there's so many
Yes.
ways that a person is suffering, and, our solution is, "Here's a pill for you because this will make you a shiny, happy person,"
I
So,
and if I can take that one step of inquisition farther,
do
okay,
it.
which some people say, "This is such a stretch." I say, "No, I actually I don't think
Nothing on
so."
this podcast is a
You
stretch, by the way.
you know what?
Or
Thanks,
is it
well, maybe
all a stretch? I don't know,
or is
you
it
won't know. It's the
all yeah,
gaslit truth.
yeah,
Who knows?
I mean, it's you
Mhm.
gotta figure out where you fit in this, but when we
Right.
also think about the idea of that type of medication, right, we're talking about, a class of drugs that one is fairly cheap to create, okay? We are
Mhm.
going to put a bunch of money into advertising that, because it's more of a blanket drug too. So think about the idea of cancer. Let's go back to Pfizer, right? And looking at this fight for cancer, right? There are many more individuals, stats wise, number wise, in the United States, let's say, because this is the research I've pulled. I have not looked in many other countries, okay, that suffer with general mental illnesses versus cancer. Okay.
Mhm.
And so that drug, to advertise that heavily works because it's a blanket. So you know what? You might not be sleeping, antidepressant. You feel lethargic,
Right.
antidepressant. You have no energy, antidepressant. Oh, depressed mood, antidepressant, right? Versus this cancer drug, right, is very specific. Okay. It's not a blanket drug. And so I look at this too, and I'm like, it makes so much sense when I get really inquisitive about this, that not only do you put a bunch of funding into that, but it is such a accessible, it
It's
covers
easy.
everything.
It's just
You
easy.
don't sleep? Oh, here you go. Here's the drug. You have high blood pressure, or maybe there's some anxiety. Okay, there's a drug. It covers so much. Covers everything almost, right? Like,
Well, and it's easy.
oh,
It's easy to prescribe, which is why
yes.
I think
Yeah.
so many healthcare professionals of different, not professions, but, I can't think of the word. Anyway, uh, help me
I'm
out.
trying. I'm trying. I'm
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 so
really trying to figure out
sorry.
I'm trying to figure out where you're going with this,
Focuses,
and
different disciplines,
yeah, yeah,
all prescribe
they
it.
do.
So you can go to your
Yeah,
family doc, you can go to your OBGYN, you can go to a psychiatrist, you can go to
yeah,
pretty much
yeah,
anywhere except maybe
it's
a
pretty,
dentist, I don't know, that
even
will
a nurse
a
practitioner
nurse
or a nurse
practitioner.
practitioner,
They
yeah,
all prescribe it, and this is an interesting conversation because I was just having it with my husband, and I said, because I talk a lot about, can we stop comparing taking this to, a diabetic taking insulin? Because
yeah,
if you're a diabetic who takes insulin, like, you also have to do probably some math calculations.
yeah,
What is your blood sugar based on how much insulin you need? All of these things. Whereas you go into a doctor to get a psych med, it's like, let's start you at 150 milligrams. And then you go back and you're like, I feel terrible. Let's up that to 250
yes,
milligrams. You know what I mean? It's so
yes,
the prescribing to me, and this, again, this is my truth, feels so unscientific and so general and so just like what you were talking about. It fits so many people's ailments all the time, and it's easy to prescribe, which is
yes,
why so many different disciplines of medicine are able to prescribe
Yes.
it.
Yes.
You probably wouldn't go to your OBGYN and get a prescription for insulin if you're a type
Mhm.
1 diabetic. You're probably gonna go to an endocrinologist for that, like,
Right.
a real specialty. So I think that's also washed out psychiatry as a specialty.
Mhm.
But, if you're getting scripts from so many different disciplines, like,
Mhm.
that is a lot of people versus making them go to a psychiatrist to get the script, like you would go to an endocrinologist to get a script for insulin probably, or a specialist in that
Yes.
area. But we
Yes.
don't do that. It's so generalized for everyone, but, you know
Yeah. Well, and that's a scary thing when and we have talked about this idea of prescription ailment, meaning or some form of a side effect, right? And then another prescription. So I also think about this idea if we are blanket prescribing, okay, for multiple ailments, right, and there isn't a ton of science, say, to back it, right? We're going to use the word science very loosely because sometimes we love science and sometimes science does fail
Oh,
us,
yes,
for sure.
obviously.
Uh, yeah. But then it's like, okay, so here I am and I have a side effect and I can't get through it. Things are really difficult. So the ability or at ease the ease by which the conversation then floats to, well, then let's give you something else for that side effect. Um,
Right.
and it's easy to have that conversation, and then it's also easy to put that next prescription on it too, because it's accessible, right? It's just
Well,
uh,
I did a post over on Instagram. I just wanna read it.
okay.
It
Oh,
got some,
did it get some
some
heat?
it
Woo!
no,
A little
no,
bit.
it got some good
Oh,
stuff. It said, "I
go
take
ahead.
metformin for the diabetes caused by the hydrochlorothiazide I take for high blood pressure, which I got from the Ambien I take for insomnia caused by the Xanax I take for the anxiety that I got from the Wellbutrin I take for chronic fatigue, which I got from the Lipitor I take because I have high cholesterol because a healthy diet and exercise with regular chiropractic care and superior nutritional supplements are just too much trouble."
What I did that was on the back of someone's shirt,
It
right?
was on
That's
the
the
back of
picture
someone's
you
shirt,
posted? I
yes.
saw that. Boy, does that say a lot. So what that
It
says is
does.
sounds much better than me talking about putting a med on a side effect, but that's exactly
Well, it's
what it
just
is.
that's what happens when you med stack, like, you get
Yeah,
you start one place and you end up 4 meds later,
right.
and that can happen with just about any classification of medication, really, you know?
Right,
But I do
right.
wanna talk about this real quick because, like,
Yeah.
I do get heat all the time, like, "Why are you talking about medication, blah, 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 blah," and I'm like, "You guys, most people don't understand that therapists, psychologists, though we can't prescribe, we are the right-hand person of
Yeah,
psychiatry.
we are.
And the majority of the information that I got, I ended up taking a few extra biology classes, and I know we both took psychopharmacology classes for our license, like,
Mhm. Yep,
and we have that visual experience where we
we do.
work and where we continue working of monitoring people who are on psych meds because you're seeing a psychiatrist or your prescriber once every few months. You see
Right.
a therapist every
Yep.
week, every other
Right.
week. Like we've got more eyeballs. So we have to be on top of what is trending, what is real, what is a side effect, when is this person suffering so much from their psych meds that we think that's a psych med that we need to send them
Mhm.
back to somebody. Like we need to
Yes.
have these conversations. And I catch so much heat for this on social media. Like, how dare you talk about these things? I'm like, so your training doesn't. I'm like, what? Why do people think that
Yeah.
their
And
training
I
is number
I
one?
think I know. I think some of that is people are so naive to the actual, like, roles that we have, right? And the last podcast that we, when we were on the Blueprint podcast, right, that
Hmm.
we've been on here recently, um, we talked about this idea of like how siloed the professions are, right?
Hmm.
And so people that aren't even in, because we were talking about the professions ourselves being very siloed. You got your head doctor, you got your med doctor, you got your rec therapist, you got your social worker, all these things,
Right.
right? And we were talking about this, but I think if we flip that the way we're looking at this, I think it's also very siloed in terms of how the community that's not involved in this, okay,
Right.
that's the response you're getting. They're also very siloed because I don't also think people realize that when you are working in any kind of a treatment team environment at all, right?
Right.
At all, Or if you're in a private practice and you have somebody that is willing to offer consent for you to discuss between the two professions, right?
Right.
We fall under the one that has so much knowledge because we see people more often. We talk to them in a different way. Our appointments aren't 7 to 10 minutes, right? We are there
Right.
an hour every single week. Oftentimes, your psychiatrist, you're going to see them. Okay, we're there for 15 to 30 if you're lucky. By the way, and
Lucky.
yeah, we'll
Mhm.
see you in 6 to 8 weeks. We'll go back then, right?
Or
Again,
months,
if
by the
you're
way.
lucky, right?
Yes.
I'm giving, like, ideal scenarios here too,
These
right?
are ideal because people are like, "No,
Yeah.
that doesn't happen," but
That's right. So here we are. So we have all of the knowledge. And so I also think people that aren't part of this don't understand that either, which is where you get some of that response, right? And that
Mhm.
backlash on from people on social media, just because that really truthfully is the way that our practices operate.
Mhm.
When I have a psychiatrist and I'm working with a client and they're willing to, they sign a release and we have these conversations, it's very surface what that psychiatrist can offer in terms of knowledge. And then I bring in the whole family system. I bring in, listen, I'm meeting with them every week. I can tell you physically, this is what they look like. Like, I am
Well,
seeing that in front of me, right? Like, that matters.
yes, it matters a lot, and in the prison system, I mean, we were with people 8 hours a
Oh my
day.
god, my office
Yeah,
was on the housing units where they
exactly.
lived all day. So,
All day
I
long,
watched my
every day.
clients
All
all
the
day.
time, all the
Yep.
time. And I
Yes.
also think about, like, the amount of continuing education hours in Psychopharm that I've took, and also, I don't know if you remember Farm Fridays. Do you remember Farm Fridays?
Is
No,
that like the thing you started when the wheel was invented back when you were,
no, but
Okay.
this is when, pharmacy reps would come in, and I
Oh.
think it was one Friday a month, I think. I
I
could
don't
have that
remember that.
wrong.
In the prison systems, they would come in?
Yes, they would go over to
Oh.
the larger mental health institute, and everybody would go, all the
Mm,
therapists and everybody would go, and they would have all these pharmaceutical reps there, and you could walk around, they would talk to you about, that medication and what it does and all those things, and they
mhm.
would serve you food, and most of the time, we just went there
Yeah.
for the food.
For the food, yes.
Yes, for the food, and so that is no different than many other, farm reps go into, doctor's offices and do the same spiel, and,
Yeah.
so that also is considered education, so
Right.
all of those things, like, we had a lot of, exposure to and involvement with, psychiatric meds, and
Mhm.
other meds, by the way, but mostly psychiatric, but
Sure.
so I think it's so fascinating to me, and I always wonder, like, do you think because I studied psychology or counseling that all we did in class was sit there and learn how to not talk and shake our head and nod, "Mhm, how does that make you feel?" Is that it? Like, that's all I did for 3 years of a master's degree and then,
Yeah.
another
How
7 of a
how
PhD?
does
Like,
how does
how
that
does that
make you
make you
feel
feel?
talking about that
Yeah,
today? How's it
yeah,
make
I
you
don't
feel right now? How you doing?
uncomfortable, uncomfortable.
It's very disheartening. It
It's
like it
very
Oh,
disheartening.
it's so disheartening, and then we could go back to where we started with this, which I never even thought about this before, but talk about yet another, integral form of marketing, the Big Pharma Friday, right? And what that was, and so I was never part of that. Like, I don't recall being a part of that, but what I do recall is, even prior to starting in the prison system, I worked for a healthcare system for many, many years, and I worked in, PR and marketing. Okay,
Oh, yeah. Yeah,
all right. So
I did too for a nursing home, by the way.
yeah, and
Mhm.
and I remember even on those on even though I was not a nurse, I was not a clinician at the time, right? None of
Me
that.
either.
I was doing all the backdoor stuff, right? To do PR and market things, but those reps would come in by us. And I'd be in the public relations office, and here they're walking through with all their merch and their subs and their
Yes.
donuts
Yep.
and I'm like, I remember sitting there. I mean, so I was probably like 19 or something like that, or 20. And I remember sitting there looking, I'm like, I don't
What are
Okay.
you
Like,
doing? Yeah, sure.
I'll take some free keychains and, "Oh, give me
Right.
some of those pens," and, "Oh, thank you for bringing us food," and it was just so like, "This is fantastic," right? And
What
so
a treat. What a
ano
treat.
another form, right, of
Mhm.
just kind of infiltration that I never got inquisitive about, right? Like, it was just great, I'll
Mm-mm.
take the subs and the food, and I'm walking around with all the merch, all the things, right, you know?
You're a walking billboard at this point.
Yeah, and now so you say Big Pharma Friday, and I'm thinking back in my life, and I might have
Same
not have
thing.
been part of that, but that was that same strategy
Mhm.
of how do we market something, but the consumer doesn't actually know a ton about it.
Right.
Like you guys are taking the next step to cure cancer, and I'm not trying to remove the mission and the path or minimize this in any way, shape, or form. So I'm sure there's some people, again, people be irritable when they listen to this and go, oh my
Mhm.
gosh, no, I'm not trying to do that at all. But it's a very interesting angle to take that something makes us feel so good. And yet there are so many things to these drugs, to these things, to how you got to be $1 billion enterprise
Yeah.
that it is hard to swallow, actually, way harder
Well,
than,
that
Jen's
the
talking bad about a commercial here. Like,
right, well, that the commercials, even though they're saying such not this particular Super Bowl one, but some
yeah.
of the, psych med commercials, they're saying
Oh,
some very terrible things in there. If you listen,
yes.
they're saying some very
Yes. Okay.
terrible things. Go
Can
ahead.
we do one? Can we do one?
Oh,
Can I can
sure.
I can I impromptu do it right now? Okay, I don't even know what it was for. I don't even know what it was for, but I heard it. I heard it on the air this morning, and I was sitting in my car like, "Oh,"
Yeah.
right? And it was, I don't know what the drug it was, but it was something very so for our listeners who are listening, like, "Well, what are you talking about when they say terrible things?" Are they okay, so here's an example. So, my wife and I, we were unable to go on our vacation last year, and the
I know
reason
this
that
one.
we couldn't go on our camping vacation that's every single year and means so much to us is because my wife got RSV. And so what did this do to us, right? And so, we decided in our old age that that matters and our trips matter and us taking this every single year together, we have to do this. So what did we do? We took that protective step and we went and we got vaccinated for RSV. And now our camping trips happen every year and we're going to age together so well with our dream. RSV side effects include loss of
Yes.
hair, loss of death, blah, 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 blah,
Right,
blah, blah,
right,
blah.
right.
Ask your doctor about the blah, 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 blah. And I'm listening and I'm like, oh, here's these two old people and they want to be on this trip and they want to grow old together and camp every year, but they can't because the wife got so sick.
Mhm. Why
That's not
is
my
it I
that's not
just
my
have to
best acting portrayal
but
of
wait,
big
because
of farmers, but woo.
I thought you were gonna do one on the migraine stuff, where it is another
Oh,
woman
geez.
who's laying on her couch and
Yes.
she's missing out on a trip or something like that. Why
Yes.
do they target women? Well, because women
Yes.
are the biggest consumers of this stuff, but it's
Right.
always a woman who is in
It
desperate
is.
need of
It is.
saving, in
Yep.
some way, whatever it
Yep.
is, and, I the new ones out that I've seen for, like, tardive dyskinesia, have you seen
Mhm.
those? Like
I have.
TD?
Yes.
Right, and
Yes.
I just sit there and I'm like, those side effects, like, a side effect of these medications is more tardive dyskinesia, like, and I'm
Yes.
like,
Yes.
"What? Say
You know,
what?"
the other demographic that is being targeted very heavily in the last couple years is the gay community. Okay. And
Interesting.
those commercials as well, are starting to you have gay couples that are in these commercials, right?
Mhm.
And it wasn't always that way years ago. Now I also understand that we have opened ourselves up to more inclusivity in the world, which is freaking fantastic. It's about damn time. Okay. And I'm looking at these though and I'm watching and I'm like, so this is really it feels good because we're bringing these other communities in, but does it feel good, or are you finding another community that you're targeting now? Because it's not just the woman anymore, right? It's
Right.
not just the elderly couple because that one is constant, right? It's
Mhm.
not just the mom, who, yes, is laying on the couch going, look at what I'm missing out in all my children's lives, right? Like, here they are outside throwing frisbees, right? And everybody's happy, and the mom's on the couch. I'm like, okay, in what world are your children outside getting together, like happy together, throwing a frisbee? First of all, that's much bullshit because kids are not, brothers and sisters
Second
are
of all, it would be the mom facilitating them out there throwing the
right.
frisbee.
Right, right, and I'm thinking like, okay, my 2 children, they are not gonna go outside and throw frisbees together and be happy, and I'm on the couch
Right.
with a headache, like, that's just not
That's not
ideal,
gonna
which I
happen.
giggle about that ideal, like, world, but
Mhm.
that's what they're painting for us, right? Here's
Yes.
what you could have, and your kids are so happy outside, and you're missing this. There's the dog. Oh, the dog's always in there too.
Yeah.
The dog's out there running. Here you are on the couch with your headaches, and you're missing out on your children's lives and on these moments, which are all created and not super real anyways, but it pulls at your heartstrings
It
because
does.
there goes the guilt. Because
Oh,
there
the
comes the
mom
guilt.
guilt. The
Here
mom
comes
guilt
the
is a
guilt, right?
real thing. Yeah.
Right. So they're pulling these populations in. And so the gay community is being targeted as well within this more recently. And I personally, I am noticing this in these ads and I'm thinking, hmm, they're really stepping up things, right? And
Yeah. And
probably
well,
for the wrong reason too. Right?
right.
Like I don't think you're targeting these communities because of inclusivity and wanting to bring
No.
this piece. You're targeting these communities because you've been missing them for a while and
Yes.
now you can tap into them in your
Right.
marketing.
Well, children too. And I would
Oh, yeah.
guess that there's gonna be a lot more marketing heavy to kids,
Yeah.
which is really sad to me. But again, that's marketing directly to consumers. So when you see them
Yes.
marketing to children, you're actually gonna see them marketing about children. They're
Yes.
marketing to moms and mom guilt about their child. So
Oh, that's
really, I
so
mean,
smart.
women are being I know, they're so
It's
smart.
so smart.
So
I mean, that
smart. Talk about pain
oh my
point marketing,
goodness.
let's talk about mom guilt for a second in marketing.
Oh my
So
goodness.
I have to
Yes.
share a story, and this was
Huh.
years ago. I think my son was probably 7 or something, and
Yeah.
he was just sitting down watching television. We were all just watching TV, and I don't remember what we were watching, but uh, commercial for an antidepressant came on
Yeah.
and listed all the symptoms of sometimes do you feel sad, sometimes do you feel lonely, all this stuff.
Mhm.
And he was watching this intently and he swings around. Keep in mind, he was in lower elementary school somewhere.
Yeah.
He
First,
swings
second
around
grade.
and he looks at me and he goes, "I think I'm depressed." And I said, "Why do you think you're depressed?" "Well, because the commercial said, 'Do I feel sad sometimes?'" And he goes, "Sometimes I feel sad and sometimes I feel lonely and sometimes I feel these things." And I'm like, "Yeah,
No.
sometimes we feel these things, right? And sometimes we don't, right?" So I was like, "You bleep dee bleep de bleep bleep bleep." Like, I was so mad because it's, like, infiltrating, like, if sometimes you feel sad, if sometimes you
Yeah.
feel these ways, you might need a medication to help you never feel that. Oh, by the way, you might need a medication to help you never feel,
Yep.
period,
Yeah.
you know?
That's yes.
I wanna
But
get to some of these
yeah.
numbers here too, so
Yeah, let's hear it. Let's
all
hear it.
right.
I'm ready for your
So
let's hear it.
Pfizer alone, spent 156 I'm sorry, Pfizer alone is a $156 billion company, Pfizer alone. They actually would not disclose how much money they spent on those Super Bowl ads, which I think is really interesting. Why wouldn't you disclose it?
Right.
People wanted to know. But, a 30-second ad was about $7 million,
Yep.
and
Yep.
their ad was 60 seconds. It used to be 90 seconds. So if we just do simple math like that, and it could be more, it was around $14 million for an ad on the
Yep.
Super Bowl. So
Yeah.
$14 million, but I mean, of a $156 billion company, I guess, whoop diddy doo dah, right? Uh,
Yeah, that's
and
just
it
pocket
was
change. That's
to
pocket
me,
change.
and this yeah, to me, this might go under, conspiracy theory or whatever, but
Oh,
this
oh.
was really done under the guise of donating to a cancer fund.
Yes.
So that's the feel good, like, it doesn't matter what we're doing because we're also doing this wonderful thing on the other side.
Yes.
So basically, I guess they've donated $15 million over the past 3 years, which is a drop in the bucket of a $156 billion company.
Well, wait,
So
say that so 15,000,000 in the last 3 years to
3 years,
in the last 3 years to the
cancer
cancer
research.
cause, but yet 14,000,000 in a 60-second ad.
Yes,
Okay.
right.
Got it.
$156 billion company, right? Like, don't you think they could have done a little more? I don't know. I would think They could have.
You
Any
know,
Well, they
yeah.
paid Travis Kelce $20 million to be their vaccine spokesperson.
Damn it,
They
Travis.
paid Travis Kelce got $20 million, but the cancer fund got 15 million over 3 years
And they spent 14 million on the
on an
commercial.
ad.
So just on the ad. So what look at that when we're really looking at what matters, where's the heart? What's the cause, right?
Mhm.
Wow. That is some very interesting statistics there, Dr. Teralyn. I think it's them. Hi, they're the problem. It's them.
Exactly. Well, and then you can go even further, like, they spent, $374 million in federal lobbying in 2022. That's
Yes.
lobbying. That's making lawmakers see you, hear you, do things
Mhm.
for you.
Mhm.
But conversely, the insurance industry spent $160 million in lobbying, which I found interesting as well. So I'm
Mm.
like, "Okay, this gets bigger and bigger and bigger."
It
Uh,
does.
yes, and this is as an industry, this is not just Pfizer, by the way, with these numbers that I'm talking about. $6.88 billion in direct to consumer ads in 2021, $8.1 billion in direct to consumer ads in 2022. Billions of dollars are being funneled into ads for people. So I
Right.
guess, maybe I should have been working in big pharma marketing. I don't know.
Hmm. No, I
Maybe
don't
I
think
should
you
try
could
that.
have handled that. You you might have pulled like a Milton from Office Space and start the entire building on fire, which is
Exactly.
exactly who did that because
Yeah.
there's scary. They ended up putting her in the basement because she couldn't shut
Right.
up about all the big secrets. She's
Right.
gonna go down to the basement with her little red
Mhm.
stapler, and pretty
Right.
soon the whole place
Exactly.
is on fire, and we're all like, "Oh, I wonder who did that."
I wonder how that happened. In no way does that insinuate that I'm gonna be lighting anything on fire, you
Oh,
guys.
yeah, we
Just
didn't
so
say
you
that
know.
yet.
Oh my gosh.
We just
Like, there's
yeah,
a
just
disclaimer on that.
yeah, no,
I only do podcasting like
just
this.
the
That's how
DSM,
I
it's fine.
ruffle
Mhm.
feathers. Yes, exactly. But these numbers are just so
Yeah,
they're so
they hurt.
incredible, and so then that takes me down a little rabbit hole to, did you know, let's see, I don't know if you want me to share the screen on this one or not, but, you can go in and find out how much, pharmaceutical companies paid physicians and even non-physicians. All you guys need to do is go to openpaymentsdata.cms.gov, and you can search by state, you can search by individual practitioner if you want to see, and they have to report everything now that they do. And some people get paid peanuts, nothing, but other people have made a significant career out of getting money for lecturing and things like that through big pharma. So again, similarly to Jen, when the farm reps would come in, these guys are walking, talking billboards wherever they go for that drug. It's usually a drug or something. It's not
Yep,
the whole company, but
yep, yep.
they're walking, talking billboards, which means, that is kind of, in my opinion, biased care, right? So if you
Mhm.
are getting money from somebody to go and lecture about, medication A, do you really think that you're not going to be promoting medication A to your colleagues in your
Yes,
clinic, to your
yes,
patients? Like, do you really think you're not going to do that? You have a vested interest now to continue that
yes,
relationship. And that
yes.
is, biased treatment, right? Conflict of interest stuff.
It
Mhm.
it it is, and I have had people challenge me on this from a personal level within, what we do, right? So, you get trained in all these things, right?
Yep.
And that becomes something that you continue to sometimes blanket put on people if it seems to kinda maybe fit, right? We'll do this treatment, this treatment, this treatment. Jen, people are paying you to talk to them as a therapist. So, how is it that your biases are not coming through? Like, because we're human, because this is all you're preaching, right? Okay. And so you're actually doing what they're doing just in a different way. Okay. And I can challenge that. I can challenge that. And I like that actually, that question, because thank you for thinking about it in this way. That's
Mhm.
the whole freaking point of what we're doing here, right?
Yes.
Call me on the carpet and say, well, then how do you? Yeah. So, because were we trained in trying to not let our biases shine through? 100%. Were we taught about the transference and what happens, when we're, well, counter transference, right? Were we taught about all that? Absolutely. However, what I say to people though is I myself, I can speak for my truth. I can't speak to any other clinician, but I have built a practice around helping patients get very curious
Mhm.
about what they need.
Mhm.
So I have that is like something that, and I know you sit in this space as well, which is I think why for you and I this podcast just makes sense for us, because we will never be the diehard cognitive behavior therapy. We will never be the diehard psychotherapy. We will never be the diehard only nutrition. We will never be the diehard EMD, DBT, CPT. All these damn acronyms for everything are the fix, right? Because we've built this world. I have built this world around people ask me questions and I will answer it with a question, because I want you to think about it a different way until you figure out what works for you. And then that is where we start.
Or
Um,
I'll even get curious too.
yeah,
If somebody brings up something, I'll be like, "You know what? I do not know the answer to that, but I'm super curious. So I'm gonna look
yeah,
for it. Like, I'm gonna see
yep,
if I can find it as well as you finding it, and let's talk about what
yes,
you found out and what I found out," right?
yeah,
It's this collaboration is the
yes,
biggest thing in therapy.
yes,
I just wanted to bring up one probably final point here as we wrap things up.
yeah,
And I think we brought it up before, but even it comes down to the screener tools that are used in our offices for depression and anxiety and other mood disorders
PTSD, yep, all of them.
are yes, they are brought to you by
Big
Big
Pharma.
Pharma. And that to me is a huge problem, and you can see it right on the bottom.
Yeah,
So we're
it's labeled
basically
there.
and some of if you look at these, probably any person at certain times of their lives could qualify into these
Yes,
categories of the screener. And these are screeners, though. To me, I'm like, these are screeners. I think they are. Well, I mean, I know there's research out there that says using universal global screening is counterproductive because too many people get caught in the net and
super
they don't.
saturated. Yep.
Yes, they don't need the intervention, but they end up getting it.
Yeah.
And I know in a doctor's office, I think a screener should be, "Oh, okay, you're being screened for these things. You should go see a therapist. Let's do that." But they're using them, in my opinion, as ways to prescribe. "Oh, we've screened you. Yes, you hit so many markers of depression. So
Mhm.
would you like an antidepressant because you
Yes.
meet these criteria?" And it's like, yeah, I mean, these criteria are not like g they're too broad in my
They're very br
opinion. They're
they're
very broad.
very, very broad, and that's the
Mhm.
point of a screener,
And
and I
they're usually also, like, in a short amount of time frame, like, I think 30 days, like, in the last 30 days or in the last 2 weeks or in the last
yes.
week is what they start
Yes.
asking you
Yes.
about, not, like,
Yes.
globally, "How do you feel?" It's like in the last week. Well,
Mhm.
lots of shit can happen
Mhm.
in a week's time or 2 weeks' time. If you think about a kid, yeah, in the last week,
Oh
I failed a
gosh.
test and I didn't do well on the field and, like, I
Yes.
feel pretty terrible. I think you need an antidepressant, or whatever, like, so these are some of the problematic things that we really want you just to begin to think more critically about or just, sit in the overall discomfort of how
It
you
well,
feel when we talk
eh
about this,
yes, and where we started is where we're gonna finish, right? So where we started was, sometimes science is not as truthful, right? As that commercial made us feel it is, right? And
Mhm,
so we look down at the opposite end of this, and even what this example you just gave, right? Like, we are here saying to you guys out there listening and watching that in our profession and in multiple other helping professions, we are giving assessment screening tools to people that I didn't even know this until I started getting curious about it. And I looked at them, I'm like, oh my gosh, they are 100% backed by a pharmaceutical company. All the research that went into putting this depression screener out there, that very much so leads to people getting a prescription. Okay, especially and depending on where you are, because if you're not with us, you're not gonna get one with us, but any of the other professions you will that can prescribe, because I can't, right?
mhm,
But that research that backed that label right on there that created this screener was coming from a pharmaceutical company, right? And so when you think about the idea of that for them, they're vested in your getting a even mild depressive diagnosis for a reason, because
mhm.
there will be a prescription from it. And so that whole chain of events, get curious about it, because is science always truthful? Is there a conflict of interest that led to studies being shifted a certain way? give a shout out to Dr. Yosef, because that man can talk about that all day long. And
Love him.
we're gonna get him on this podcast because he has talked about it before as somebody who worked in that space and was unable to make a change doing some of that research for the pharmaceutical companies that he worked for, because that does not fit this model. So think about that. We're wrapping it back to the beginning. That's really what I want
Yeah.
people to get curious about.
Absolutely. So I guess don't be blinded by science. Don't have science blindly lead you. Right. One last time for the road.
I mean, here we go. This is a thing, right?
Yep. Oh,
Oh,
I got it on backward now, but
oh, do
whatever.
you? Mine's just
All
not
right.
staying on this. Look at us doing my hair. I look fantastic. All right, here we go. Put our bras on. Okay,
All
so
right.
how can you find us? Terry, tell everybody how they can get to us here.
So please listen to the Gaslit Truth on Apple, Spotify, or wherever you listen to podcasts. And make sure you follow us on Instagram, Facebook, and YouTube to get these wonderful videos of us wearing bras on our heads. And you can follow Jen and I on pretty much any social media platform. If you're listening to this, it'll be linked in the show notes. And you can
Yeah.
find us wherever you watch social media.
Yeah, the Gaslit Truth. That's all you've got to
The
know. And you can
the
find us.
Gaslit Truth
Yeah,
Podcast. And if
that's
you wanna reach
important.
out if you wanna reach out to us directly, the Gaslit Truth Podcast at gmail.com. So here is to the next fight, according to Big Pharma. Peace out.